So she says that each person has the ability to care for themselves, and we should be caring for ourselves. But sometimes we have our self-care demands, the things we need to do in order to be healthy, and sometimes there's a deficit in that. We can't meet all of our demands. But sometimes our deficit is because we can't do it. We physically can't take care of ourselves. And sometimes it's because we don't want to. It's our agency, our desire to take care of our health. So if we either have lack of desire to care for ourselves or lack of the physical ability to do it, we have a deficit. And this deficit is where nursing can help deal with our problems. So if I have asthma or chronic obstructive pulmonary disease, I have COPD, and I know that I need to take my puffers, and I know that I should quit smoking, right? I know this information, and I know that this is the demand, that I need to quit smoking. However, I don't want to quit smoking. I like smoking, so I have no agency to quit smoking. So I'm going to continue to injure my lungs, right, by doing that. So my deficit then is my knowledge about, or my desire to quit smoking, even though I have the knowledge about it. So how can nursing help with this deficit, right? This would be the nursing role. How do we teach our patients about the implications of that? How do we encourage them to quit smoking? How do we explain to them the long-term side effects of smoking when you already have COPD and, and things like that, right? Or maybe you have an acute exacerbation of your symptoms, and nursing has to help you in a very difficult situation related to your breathing. You get scared, and so maybe your agency changes, right? So this is where, this is Orem's model of the way she thinks about nursing care and the way that we provide care. So there's just some definitions. I'm not actually going to go through the definitions of Orem, but if you choose to use Orem as your nursing model, you can review the definitions, some key words about her terms and her ideas.